questions I had before. So this next question I've got is, I have to remind myself to eat. Surely that's a good thing, as I'll lose weight quicker. Not necessarily. So obviously the purpose of taking weight loss medication is to help support the diet component of losing weight. So we know that losing weight is a complex thing. There's lots of elements that go together. One area that the medication helps with is diet. It's helping you control how much and what you're eating. We know that you also need to address the body side, so the exercise and movement side, and there's the mind side as well, controlling, all the relationships you have with food and how you eat, and all of those things need to come together to get your best results. So the medication works to help manage the diet side. But absolutely, it is not there to eradicate your appetite. The idea is not that you don't eat at all. Number one, that's not healthy. Your body needs fuel, nutrients, vitamins, minerals to work and to function. We need it to live, and to thrive at life as well. If you're not eating and your body's struggling for energy and the vitamins and minerals it needs, you won't be healthy. You won't feel good. And two, to get your best weight loss results, there's a sweet spot between having enough of a calorie deficit that your body burns your fat stores, but also having enough food to keep your metabolism going. If you eat too little, you find that you drive your metabolism down too much, that actually your weight loss progress can slow. And this can be a common reason why people plateau. People start losing weight doing a particular diet. You eat the way, the amount of calories, maybe you're a calorie counter, that you've done that, you do the diet you've always done. And that works when you start. But sometimes actually, as you go through weight loss and your body changes, your weight changes, your body composition changes, that calorie balance of what you should eat and the amount you should eat can change. And sometimes when you get to that plateau, people can think, I'm not losing enough weight, so I'm going to eat even less. And actually that slows it down and you don't get that best result. You do have to feed your body. Metabolism, the act of breaking down fat takes energy. Your body has to physically do a chemical reaction to break the fat down, to release the fat, to burn it away. And if you don't give your body fuel to do those things, then it won't do them as well and you won't get your best results. So not eating at all is not healthy. And it won't get you your best weight loss results. Being in control of what you're eating, being able to decide what you're going to eat, being able to stick to your healthy choices, being able to eat how, what, and when you wish to, is how the medication should help you. As I say, it should not be at the point where you're not eating anything, because as I say, that's just not healthy. And you don't want to feel like not your best. The idea of, obviously there's lots of reasons to lose weight. As a doctor, I sit here and say to you, I'm only interested in your health. And that's the reason as doctors we care about when people's weight goes overweight. We don't want to make people feel uncomfortable about how they look. Everybody can look how they like. Everyone can express themselves in whichever way they wish their appearance to be. But as doctors, for us, it's because we know over time having an excess in body fat can lead to health conditions. We know it does. Everybody's different, how quickly that can happen. But we know there are lots of conditions now, type 2 diabetes, heart disease, types of cancer, that can all be associated with being overweight. Because sadly, fat doesn't just sit there and do nothing. It's active. It does things in the body. It can be pro-inflammatory to the body. It can make changes in all of your organs across your body. So what we want as medics is to help you lose that fat weight, only the fat part, not the bone or the muscle, the fat part of your weight, because we know actually it's going to help you feel healthier and then feel your best and be more energetic. And, so there's lots of reasons why it's really important to make sure you fuel your body to get those best weight loss results. And that's why, although lots of people look to get the medication online, and that's absolutely fine, get the medication, sort of stick to a plan that maybe or that's worked for you before, which is, totally everyone's choice and how they wish to lose weight. We really find that patients who engage with our doctors and our dietitian and actually get that little bit extra advice on what to eat and adjusting your diet, and also thinking about how you eat with these types of medication, because again, what you're eating, because of the way they work on your gut, you can find actually there are better things to eat than others. And we have a membership area called the Slimming Club that we have alongside our weight loss treatment. And that is for people on weight loss medication, whether you get it from us or you get it from anywhere else. And it's a plethora of resources, tips on diet, recipes, movement, mindset. If you are on, you ask some questions when you join, and if you are on a weight loss injections or weight loss tablets, you get dietary tips based on how to get the best results from those medications and avoid, getting side effects as well.